everyone. Dr. Sarah here. I'm super excited to do this stream with you guys and talk about sexual wellness and intimacy. I'm going to just wait 1 or 2 seconds to get going, but I'm just really happy to be here. I'll tell you about myself and what we're going to be talking about today. Um, so, I am a board certified OBGYN. I've been in practice for a very long time, over 20 to 23 years now, not counting residency. I'm also a functional medicine provider, so I was trained as an MD in conventional medicine, and then I did extra training in functional medicine because I really appreciate a holistic approach to my patients. And then I'm also a menopause certified practitioner by the Menopause Society. And I am the chief medical officer of Joylux, which is a menopause care company. And I am also the clinical lead of Respin, and that is Halle Berry's menopause care platform. And so I am menopause and perimenopause all day, every day. I see patients in my own private clinic, and then I'm consulting in the menopause space as well. So it's really great to be here. I'm so happy you're here, and I'm happy that you are interested in talking about your sexual health and thinking about intimacy, and especially as our bodies change through our different reproductive stages. And we're going to talk a lot about that today, what goes on in our bodies between perimenopause and menopause and then postmenopause. But first of all, like, why Joylux and Foria? Like, why did these two companies come together and want to do this? Well, Joylux, as I said, is a femtech women's wellness company. We've been around for a very long time. We were in the menopause space really before it became hip and cool. We have a red light therapy device that's used to treat vaginal dryness and improve natural lubrication. And then we have lots of other clean pH balanced products that can add to your intimacy. Halle Berry and I and Joylux created an intimacy gel that's used to increase, pleasure during sex. And then Foria is this amazing company. They have incredible products that are botanical and plant-based, also clean ingredients, pH-based, pH balanced, and they add CBD and other botanicals to not only enhance sexual pleasure, but also your sexual wellness and then your intimate wellness. So Joylux and Foria have a lot of synergy between the two of us. And so we decided during the Menopause Awareness Month to really talk about sex and menopause and break the silence and break the taboo, this idea, this stigma that women don't have sex after perimenopause or menopause, or you're all dried up and your sex life is over, which is not true. So we are really committed to, and I'm committed to, educating and empowering women. We want to give you tools and knowledge and products and support that you need to enjoy your sexual health and understand what's happening in your body, and then just increase your enjoyment in your intimate lives. And also your confidence. I feel like that has a lot to do with our sex life, is how we feel about ourselves and how we're supported in this environment. So that's what we're going to talk about today. I'd like to start with kind of going over what really does happen to our bodies during these reproductive stages. And so I'll do a little science here, but not too much because I know it can get boring. But when we're younger, before 40, where most women are in this sort of pre-perimenopause. We're in our reproductive years where we're more likely to get pregnant than not. We typically are having regular cycles, periods, unless we're having some issues with like polycystic ovarian disease or something else. But if you take, women who are having regular cycles, our hormones are pretty regular. We build up estrogen in the beginning part of our period. We ovulate when estrogen gets to a certain level, and then progesterone rises. And then if you don't conceive, and this is off of the birth control pill, then the cycle starts all over again. And so with women with regular cycles and balanced hormones, this nice little phase that's should be very regular. Then perimenopause happens and it's kind of chaotic, right? Perimenopause is a very chaotic time hormonally. Usually progesterone drops first. You can get PMS and anxiety and period changes. Estrogen then declines, and testosterone does a slow decline through our reproductive years into perimenopause and menopause. And the decline in estrogen is a big part of what changes our intimate wellness and our vaginal health. We can start having urinary tract infections. We can start having vaginal infections because estrogen really supports a healthy pH in the vagina. It supports a healthy microbiome. We have lots of healthy, good bacteria in there, and those can get out of balance. And then it can lead to dryness in the vagina. So then you're having discomfort with intercourse, or even if you're not having sex, you can experience some discomfort and just dryness. Women tell me that I never used to really be aware of my vagina, and now I am, right? So it's just sort of this irritation. You can have itching and dryness and other issues. Testosterone plays a role because testosterone can turn to estrogen in our bodies naturally, and it promotes estrogen, but it also does its own part in our intimate wellness. It can help with vaginal lubrication, but more importantly, it helps with blood flow and sex drive, libido, and then orgasm intensity. So as testosterone and estrogen decline, you might notice that you're not that interested in sex anymore. You're not initiating it as more. You're not interested in masturbation or self-pleasure, and you are having less intense experiences sexually. Also, other changes separate from sex can also just be elasticity and tone. Like our vulva can become, the labia can become a little bit more um, longer, change shape, but then as you get less and less estrogen, then that tissue can become pretty thin and dry, and then the opening to the vagina can get smaller, and that can cause some discomfort as well. So this all sounds crazy, right? And terrible, especially if you're not this is not happening to you and you're thinking about it happening to you. It can sound pretty intimidating, but it's very normal and it's very natural as our hormone levels change that these are going on. So as terrible as it sounds, with the right tools and right support and knowledge, it's not terrible at all. And most of my patients have had a little bit of dryness, and then we do what we need to do to kind of intervene and fix it. And then they have comfortable and healthy sex lives. But the key, in my opinion, is to know about it, to know what's coming, and then to be able to use tools from Joylux, from Foria, there's lots of things out there that you can use to help support your vaginal health and then your sexual well-being. I hope all that made sense. By the way, you can ask questions in the comments and I'll try to answer them as we go along. We did get a few questions ahead of time, so I'll try to intersperse those in the conversation. But a common question is like, where did my libido go? Like I used to have this really healthy libido. What happened? And that is, again, as perimenopause and menopause comes around, like testosterone is slowly declining and estrogen is fluctuating a lot and then declining. And that's oftentimes the basis. Decreased libido is a low sex drive is also very multifactorial, right? It's your relationship, your stress level, what's going on in your life, and then the hormones and also self-esteem. So a lot of women in perimenopause and menopause have gained weight and share with me that they don't feel as comfortable as they used to having sex because they've gained weight. So it's lots of issues, but hormones are really a main cause of the decline and your libido, and which is essentially your sex drive. Um, so let's talk about like sexual health versus like sex. So I think everyone, when you think of your sexual health, people think of just the act of sex, where your sexual health is to me so much more than that. Sexual health and vaginal health have a lot to do with just your baseline comfort as a woman, right? So like I spoke about before, are you aware of your vagina? Are you trying to work and you're like itchy and dry and uncomfortable, right? That's part of your sexual health and your vaginal health and your well-being. Is it keeping you from being able to concentrate at work, or is it affecting your self-esteem because you feel like you're getting old because your vagina is dry? That's all very common. So I like to incorporate sexual health as like our confidence, not just our sex life and our intimate life, but our self-esteem, how comfortable we are, how good we feel in our bodies, right? That really makes a difference in terms of our sexual well-being and just our overall well-being. And then, I'm not sure, but I do think that sex, and especially in the United States, is sort of this like just sex, but sex is so much more than that, and it gives you so many more benefits than just sort of, a sex from maybe like a more traditional male perspective, but there are lots of benefits of intimacy. It's a lot like exercise. You can reduce your stress, it improves sleep, it strengthens relationships because you're bonding typically. And when you have, healthy, good sex, you release a lot of oxytocin, which is a very powerful hormone. And we have less oxytocin as we age and as we have less estrogen. So having sex, and I tell my patients this, which is helpful to many people, is if you're in the situation where, let's say you've been in a long-term relationship, your libido's gone down and you're just not having that much sex because you don't feel like it. And women tell me this every day, all day. Like, I feel bad for my partner, but I just don't feel like having sex. But then they do have sex, whether initially just to please their partner. And I would say that 80% of the time they come back and they're like, I'm really glad I'm making an effort to have sex. It is actually worth it. It feels better. And that's part of that oxytocin too, is that you actually get a kick of a positive hormone. But that being said, no one should ever have sex unless they really want to and feel like it. But there is data that shows that when we're having sex and enjoying it and making an effort at it, that it's sort of forward feeding. So it's like a ripple effect that we're feeling good in that realm that spills over into how we feel good about ourselves, our relationship, our bodies, our life. It improves how women can show up at work and love and life. So I just want to encourage you that if you're feeling that way, like sex is kind of over for you, and or if your relationship's struggling over it, then it is really important to talk to someone. You to talk to your, a good OBGYN like me, or someone who specializes in menopause healthcare. You can talk to a sex therapist. I also think communicating with your partner is really important, because a lot of partners take personal offense. Like, they feel like, oh, not attracted to me anymore. I don't have it going on, or what's wrong with our relationship, or is that, is she having an affair? That goes on more than you think. So I think open communication is really important about the changes that you're experiencing in your body as things change. So the other physical benefits that happen with sex is you actually get better circulation. It's a lot like exercise, even if it doesn't feel like a workout. Hopefully it doesn't feel like a workout, but you get improved circulation. That blood flow in those tissues is a huge, huge deal. So when we have more blood flow in the vagina, we're more lubricated. There's better microbiome there. The tissue is more healthy. And then you also have increased pelvic floor strength, just because you also have more muscular contractions during an orgasm and you're using your pelvic floor more. And then there's also that increased circulation. I think we talked a bit about the emotional benefits. You feel more connected to yourself, you feel more connected to your partner, might have an improved mood, especially if sex is getting better. And there's some data that shows that sex can reduce anxiety and depression. So again, sex, it's not just sex, it's like your whole sexual health is part of your overall well-being. And hopefully, you can focus on it in that way as well. I'm just going to check on a couple of questions really quick and see. Um, Good. We've got some good questions coming up. So one of them is pain with sex, even though my libido's great, but I'm having discomfort. So one, I'm really glad your libido is intact. That's awesome. It's so important. But you might be having pain because of the lack of estrogen or the decline of estrogen. So again, that means that there's less natural hydration, less lubrication. The tissue can get thin and what we call atrophic, where normally the vaginal mucosa is like this thick under a microscope, and then it becomes paper thin, and that causes discomfort. Some women describe it as like razor blades, but it's again very common and normal to have this as your estrogen levels decline. So that's most likely the reason. Someone else is asking about arousal and orgasms, that it just takes longer. That's also a blood flow issue. So without estrogen and testosterone, or with declining levels, there's less blood flow to the area, less hydration and lubrication. And that's why, using a lubricant or using an intimacy gel or an oil, or even, hyaluronic acid or something in between sexual activity can really help improve the lubrication and the moisturization that's in those tissues. So hopefully that helps answer that question. But since I brought it up, let's talk about lubes and tools and things that you can use to help increase your natural hydration. So one is just lifestyle. So increasing your water intake, being hydrated, just like it's important for your skin on your face and your body, it's important for your vaginal tissues, really important. So staying hydrated, exercise, again, increases blood flow to all areas of our body. If you're suffering from pelvic floor issues, like if you're having a little bit of incontinence or you feel like your pelvic floor is weak, seeing a pelvic floor physical therapist is really important. And even though it's difficult and uncomfortable to talk about, and pelvic floor physical therapists will actually touch that area of your body. So you need to be prepared for that. But they can determine if you have tightness or if there's weakness and then teach you exercise to increase that muscle strength. So all of these things are important. Yes, a healthy diet is really important because the less inflamed we are throughout our whole body, the more clean eating that we're doing, that also improves our vaginal tissue, just like it shows up in our skin. So a healthy lifestyle is really very important. And then using, there's hyaluronic acid moisturizers on the market. What those do is they keep moisture within the vaginal tissue. The downside of HA is that if you don't have a lot of moisture in there, then there's not a lot to keep in there or to add to. They are fairly effective for most women. There's other products coming on the market, but HA is a good option. Vaginal estrogen, if you're having dryness, is really important to discuss with your provider. It's generally safe for every woman at any age because it's such a low dose, but that can go far in reducing thinness and pain with sex and urinary tract infections. Red light therapy is another really great way to increase your natural lubrication. I have patients that tell me that it has been a game changer. Halle Berry said it's been a game changer. I have one here, our VFit device. This is what it looks like. And then when you turn on the red lights, it looks like that. And so it's a pretty powerful device. It's one of the most powerful red light therapy devices on the market. You insert it this far, and then you sit there and wait for 6 minutes at first, and you do that every other day. And then we have some clinical trials that really shows that it increases natural lubrication. Women tell me that all the time. But in terms of lubricants, I think if you're having discomfort, it's really important to use a lubricant or an intimacy gel. But even if you're not, intimacy gels can add to your experience. And, for example, the Foria one, I really like this one with CBD, the sex oil with CBD. I've used this one. I think it's great because what it's doing is it increasing that blood flow, right? That's the whole sort of point. And then the gel and the oils are really comfortable. They're not sticky. Same thing with Let's Spin that Hallie and I created. It's not sticky. It feels really good. And it just kind of adds to the experience, but especially if you're having some dryness, it'll make sex so much more comfortable and better tolerated and enjoyable. So I think it's to think about lubricants and intimacy gels and sex oils is not a sign of dysfunction. It's like a sign of you're taking care of yourself. You're wanting to add to your sex life. You're wanting to make sure that you're not having any discomfort. I think partners appreciate it, and certainly it reduces any discomfort that you'll have and makes it that much more fun. So we talked about the VFit in terms of red light therapy tool. That's a great tool. Pelvic floor devices. I think vibrators are sort of weirdly enough still like taboo, but vibrators are a great option. I think the statistics, I have to look it up, but someone told me like 75% of women own a vibrator. They just don't talk about it. Vibrators are great tools in terms of increasing blood flow. So whether you have a partner or not, a vibrator allows you to get to know what feels good to you. So then you can express that to your partner. Vibrators are also great, especially if you don't have a partner, because you're just increasing blood flow, using those muscles, using that area of your body. And I think it is true that if you're not using it, it's easier to lose it in terms of the comfort and the tone of those tissues down there. So vibrators are really helpful in terms of not only self-pleasure, but also just in general sexual health. And this is a lot of the things that I'm talking about today aren't just about perimenopause and menopause or postmenopause. This is for reproductive age women in their 20s and their 30s. I think it's very important to understand your body, your anatomy, what feels good, what doesn't feel good, and then what works with your body. Do you really like a sex oil? Do you like a gel? Do you like to use a vulvar oil or hydrating serum in between, right? Because it feels good. And for women who are on the birth control pill and women who are breastfeeding, they absolutely can have dryness. So vaginal dryness and vulvar dryness is not just a perimenopausal or menopausal issue. It can happen at other times in our lives too. So it's important to know about options out there in order to take, better care of your body and yourself, and knowing, what works with your body and for your body. Um, I think the stigma around sex is big in our, and it's getting better, but it's big in our, especially in our country. But it's important to really do correlate it with your health. So just like you don't wait until you get a cavity to brush your teeth, or, something terrible happens that you're like, oh, I'll take care of that now. Your sexual health is very much like your other health. It's like being proactive, thinking about what works for you, finding out what works for you, and then deciding, like, what you want to use to keep yourself healthy and comfortable. Let's look at some other questions that's going on. So a lot of about sex being uncomfortable. So again, it's normal and it's common, and it's due to lack of or decline in your estrogen levels and a decline in your testosterone levels. And again, very normal starting as early as, your potentially your 30s. So perimenopause can last 10 years. A lot of women in their late 30s, certainly by your mid 40s, you're likely in perimenopause, even if you're not having that many symptoms. And then the average age of menopause, which is when you stop having a period, is 51 for white women, 49 for Black women, and it varies by ethnicity. And so that's important to realize too, that you can be having symptoms way before menopause, and that doesn't, before the actual ending of your period, and that does not preclude you from using a vaginal estrogen or systemic hormones. It's really important to talk to an educated provider about this. So the other part is, a lot of women, there's some comments on here that I didn't realize menopause affected that part of my body, that I thought it was just hot flashes. Well, let me tell you, menopause affects every part of your body, kind of head to toe, because we have estrogen receptors from head to toe. So we can have brain issues, which also sort of sexual issues in terms of libido. Our sex drive is from our brain. So you can have, brain fog, word recall, libido issues, skin changes, breast changes. Yes, hot flashes and night sweats, which are also from our brain, joint muscle pains and aches, and then, yeah, vaginal health for sure. So it just changes our microbiome and our pH, as I spoke about before. Um, so I think what's really important to understand is that, one, where I can take more questions, but menopause doesn't have to be the end to your sex life, and it extends not just about sex, but also just about your life. There's this very unfortunate stigma about aging, and there's an unfortunate stigma about menopause in particular. Like, women are no longer worth anything. Well, I think people like Halle Berry, Naomi Watts, plenty of Nicole Kidman, like plenty of women who are in their 50s are doing an amazing job at calling attention to menopause and perimenopause, but also living their best lives. And I think it's important to understand that, yeah, they're celebrities, but there's also plenty of women around you that are living their best lives in their best chapter, but they're doing it by getting support. They're doing it by understanding what's happening in their body, finding solutions for themselves, whether it's hormones or not. There's other solutions besides hormones. Hormones tend to work the best, but there are other solutions, lifestyle interventions, tools and support for your vaginal health and your sexual health. So there is information out there. It is not game over. Menopause, in my mind, is definitely not an ending. It can be a beginning to a really important and empowered chapter in your life, in a new stage where you kind of realize you deserve more, and more joy and more pleasure and more fun and more connection. And then obviously sexual health goes along with all of that. So I would just like to, say cheers to menopause. It's been an interesting journey for me personally, and for my patients I know, who I talk to about everything intimately every day. But most women are getting through it with confidence and clarity and the supportive community. So if you're out there not feeling it, I would encourage you to try to find a really good menopause provider. Look at our website, look at Foria's website, look at Respin. There's lots of support and information out there. So I'm going to double check questions and then ask my background support people here if they wanted me to cover anything else. Okay, here's another one. So someone's been celibate for 10 years, and around now 60 years old. Is there anything I can do now? Yes, 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 yes. So even though you've been celibate for a long time, that does not mean it's over. It's going to be, I would say, a realistic, thing to give you is that it's going to be a little bit of a journey to get back to where you were before, get so you're feeling comfortable. But absolutely. So I would talk to a provider about vaginal estrogen. Some women need dilators that things have shrunk down enough that they need to sort of work their way back up to accommodating a larger object in their vagina. So there's dilators. I showed you the V-Fit. The red light therapy is great to use too because the red light therapy stimulates natural lubrication. Um, People are feeling like they have just a better sensation down there. So I would think about that. I would definitely use a lubricant or an intimacy gel or oil when you're sort of starting to re-experiment with sex, but probably you want to work up to having sex again on your own at home, whether it's with vaginal estrogen and a dilator. But yes, there's lots and lots of things that you can do now. It's definitely not over. I hope that helps, but if not, you can DM us again. Another person saying, I used to get aroused so easily. Why does it take so much longer now? So that is, again, it's blood flow, it's testosterone and estrogen. So without those key hormones in that tissue, in the vagina and the vulva and the clitoris, like there's just not a lot of stimulation. So if you think about, not to bring up men, but like men and Viagra, right? What does that drug do? It vasodilates, it increases blood flow. So sexual arousal is a lot to do with blood flow. So the less blood flow to the area, the harder it is the more difficult it is to get aroused, the longer it takes. And that's actually a really important thing. And Halle Berry likes to talk about this, that sex used to be faster or whatever, but now it's more of an event. It can be, and more of like a sensual, fun, slow event because it's going to take time. So you need to be with a trusted partner, someone who understands you're communicating with, maybe using, one of these great massage oils from Foria, a sex oil, but even just like a massage oil, like really taking the time. Women in general take more time than men to get aroused anyway, and then especially in perimenopause and menopause. So similar issue. A man can take a pill. We can take a pill. There are pills out there, but you have to take them daily. There's some side effects, but it's a good option to talk about with your provider. There's questions whether women can take like Cialis or Viagra at a lower dose. Again, you need to talk to your provider about that. But arousal does take longer, and you have to get more tools in the toolkit, have more time, thinking about like connecting more intimacy, massage, and just communicating with your partner that it's going to take more time. But it is very natural and normal and common for arousal to take longer, and then for orgasms to be less intense. One more thing about that is now online or with a provider like myself, but also online, there are things called, scream creams where they're vasodilating creams. So they have sildenafil in it, which is Viagra, or other similar ingredients like arginine, which causes dilation of the blood vessels. So there is helps with arousal, helps with orgasm. So you could look at those too. You can get them online through some prescription companies, or you could talk to a provider to get it compounded. Same with sensitivity. So arousal and sensitivity are kind of not one and the same, but similar issues. It's the blood flow, it's the hormonal decline, that things are just not as sensitive, not as intense orgasms, and then not as easy to get aroused. That's really, really common. So one person saying like they use red light therapy on their face, me too. And I think it's really helpful. But so the idea with red light therapy in your vagina and and near your vulva and that tissue is similar to what it does on the face. So lasers, when we use really high dose lasers on our face, right, it kind of burns the tissue, just, thermal damage to the tissue, and then the tissue naturally heals itself, and then we have more collagen and elastin and fibrin and like more positive things in our face that make it look healthier, thicker, all those things. So red light therapy is doing the same. It stimulates something called mitochondria, which are the energy powerhouses in our cells. the mitochondria produce ATP, which is more energy, and then that leads to increased production of collagen, elastin, fibrin, which again increases the thickness of the tissue, the natural lubrication. What patients tell me, and we can see this under microscopes when you use red light therapy, and red light therapy has been studied for over 60 years. It was, I think, first introduced in the 50s or 60s via NASA for wound healing in space. And so it's tons of studies, over, I think, 5,000 published papers on wound healing, collagen formation. We've published some papers on it as well, but it's essentially promoting tissue integrity and tissue health, and then providing natural lubrication. And then women are echoing that to me in the office when they've used it. Is like, I feel more sensation, I feel better hydration. And so that's what women are telling me in terms of their experience with VFit or red light therapy. So let's talk about clean and pH balance. Someone's asking why it matters. It does matter. So our vaginal tissue is a very sensitive part of our body, and it's also very, very absorptive. It's one of the most absorptive places in our body. So there's a type of tissue in our body called mucosa. We have it in our GI system, like our stomach and our intestines. We have it in our nasal passages. We have it in our vagina. And mucosa is incredibly absorptive, right? Makes sense. Your GI system needs to be absorptive. The vagina is incredibly absorptive. So if you're putting chemicals, parabens, PEGs, phthalates in your vagina, that you're absorbing more of those. And we do know that those chemicals can be dangerous to our health. Parabens are related to, certain types of parabens are related to breast cancer. So you really do want clean ingredients through your whole body and in your whole house, ideally, but specifically in highly absorptive areas such as the vagina. So really important. And then pH balance is important because, especially in perimenopause and menopause, or especially during pregnancy, because of the hormone changes, you're more likely for the pH to be off. So estrogen, when we have normal levels of it in our vagina and our tissue is healthy, we have a healthy microbiome because the pH is low. We have acidic, our vaginas are acidic pH wise, but that's what the lactobacilli and the healthy bacteria really like. They thrive in that environment. So as you lose estrogen and those lactobacilli die off as the pH rises, then you get other bacteria that are less friendly, and they can cause bacterial vaginosis. Maybe you get a yeast infection, maybe you get a urinary tract infection. So pH balance is really important. So if you are using ingredients that alters your pH, you are more likely to get an infection or to get irritation, even if it's not a true infection. So pH balance and clean are very important. It's not just a marketing scam or like people, using marketing to sell you things. It actually is very, very important for you to use pH balance and clean ingredients. Okay, so that's a good question. So someone said, like, if women are saying it kind of tightens things up for them, if you're older and already tight, like things have shrunk down, how does one counter this? That's a really good question. So what I would say is that the collagen, if the red light therapy is effective in your tissue, let's say that you're tighter, you may not be able to fit this device perfectly inside. So you may need to use dilators at first and slowly get up to using this device. That has happened to a couple of my patients. So that's one thing to consider. But it doesn't necessarily tighten the tissue. So if you think of a woman that has less sensation because her vagina has more volume, she's younger, it hasn't shrunk down from lack of estrogen, she's had a vaginal delivery, that woman is feeling more blood flow, she's feeling more collagen and elastin, and I would say like a temporary swelling of the tissue during sex because there's more blood flow. When someone is sort of almost scarred down, when there's less tissue there, the red light therapy is bringing in more blood flow. So that's the key, is the blood flow in that sense is bringing in a more healthy environment to the tissue, allowing the tissue to be more pliable and flexible because of increased elastin. So it's not like in anyone that it like tightens it like that much that you're going to feel like it's getting worse. And for someone who's tight and has atrophy and dryness, it's going to bring in more blood flow and healthier collagen and elastin to make the vagina more pliable and healthy, if that makes sense. So if you think of a scar, it's going to sort of like soften up that scar tissue, allow more blood flow. And if you think of sort of like really loose tissue, it's going to increase the collagen and elastin as well, and more blood flow, and that'll feel it'll feel more tight, if that makes sense. But if not, ask me another question or in a different way. Um, what can you do to get more blood flow instead of going on HRT? Great question. So again, HRT, so systemic HRT, bioidentical systemic HRT like estradiol, progesterone, and testosterone help systemically. Hot flashes, night sweats, libido, energy, brain, all that stuff. Vaginal estrogen and vaginal DHEA, which is another option, both compounded and through a prescription, through an FDA-approved prescription. Those change the tissue similar to what red light therapy does. It brings in collagen and elastin and blood flow. That is not systemic HRT. Local vaginal estrogen is safe for everyone, even women who've had breast cancer. The FDA is getting ready to take the black box warning off of vaginal estrogen. Okay, so I just want to be very clear about that. It is safe for everyone, even those with breast cancer, even those 15, 20 years away from menopause, past menopause. It's very safe and effective. That being said, some people still don't want to use any form of hormones. Okay, fine. So then you want to think about blood flow to the area. You want to think about lubrication to the area. So that would be vaginal moisturizers like Replens or other brands that you kind of have to use consistently because you're putting a moisturizer in the vagina, right? So vaginal moisturizers, those are used almost daily or a few times a week. Hyaluronic acid to kind of trap the vaginal moisture in there. That's used 2 to 3 times a week. And then red light therapy brings in more natural lubrication using intimacy gels or oils. So you have to kind of keep things, it's more of a maintenance thing that you have to kind of keep on top of it to, if you're not going to use HRT, blood flow with those types of things, massage, vibrator use, anything that kind of stimulates the tissue down there will bring in more blood flow. Okay, so hopefully that helps too. Um, I have a VFit, but I'm afraid of it. Haha. I know. Some people say that they're like intimidated by it. So I'll just go over how to use it really quick. It looks intimidating, but I mean, I don't know if you've ever used a vibrator before, but I feel like there's some crazy vibrators out there. So those are sometimes a little bit more intimidating. Okay, so here it is. You charge it when you first get it, and then you turn on the power button. A green light comes on, and then you can choose 6 minutes, just to start off at 6, and I think that's a good way for everyone to start off just to get used to it. You push that button again, the light comes on. This button can change the vibration mode. And then you put we have photonic gel, which increases the power of the light. So you put a little gel on the end of it. That way it's easier to go in. And then it's also, and it also increases the power of the light. So a little intimacy gel on the end. I turned it off because it is bright right now. It's a glare off the screen. And then you put it inside. And again, you just put it up until these lights are disappeared. You don't put the whole thing in, just so these lights are all the way inside the vagina. And then you can sit back, read a book, watch a TV show, I don't know, do a Sudoku puzzle, whatever you want for 6 minutes. And then if you have our app, it comes with an app, which is, I think, really, really, really nice because you can control the device with the app. And then we have tons of content on the app that you can read, lots of blogs and health information from me and our JoyLux team. So that's how you use it. And you should use it 6 minutes every other day for a week. Make sure you're comfortable, it feels good. And then you can go up to 8 minutes. Do that for a week or two, make sure you're comfortable. And then the maximum time is 10 minutes. When we study the device, women who use the device after 6 weeks did notice significant differences, and we saw significant differences in their tissues. But women told me privately that one, they started thinking about sex more, like it kind of encouraged them in that realm. It made them want to have sex more, which was great. We didn't study that, but that's what women told me because I interviewed everybody after the study. And then the other thing is that most women started to see a benefit way earlier than 6 weeks, that by 3 weeks of consistent use, they were noticing more natural lubrication. We didn't publish that data, but that's what women were expressing to us. So again, great option to use this device. And it can be intimidating, but you can also call us at JoyLux and we can go over it again. We have a YouTube video, so there's lots of resources there too. So this person's saying that she often hears that women in menopause should use lubricants and oils, but this is something that all women, no matter what their age, I'm not in menopause yet, but it really seems to help. Yeah, I'm sorry if I didn't make that more clear. Yeah, I mean, all women of all ages. So one, like specific use is breastfeeding, birth control. So those are typically reproductive age women, right? And they're having dryness and discomfort. So definitely use it for that. It's a great thing to use. And then perimenopause and menopause, I think we've covered. But just in general, I think using a lubricant and an oil, again, it can add to your sex life. Like this CBD intimacy sex oil is fantastic. I think our Let's Spin is fantastic. It just can kind of make things a little bit more fun. Um, not to get too detailed, but some people have sex for, a couple hours and you're going to get dry, right? And so it's good to have something there to protect your tissues and keep you comfortable. But I think in general, it's just good to have at your bedside no matter what age that you are. And what I like about these products is they're kind of pretty, right? Like you're not embarrassed to have this by your bedside. It's not like some tube of something, right? Um, so what are some basic products that you would suggest are go-to from Joylux? Okay, I have several. One is our soap, our non-soap soap. I love this soap. So Colette, our CEO, I used to say to her, because she was my patient a long time ago, I'd be like, you're not supposed to wash yourself with soap. It's drying. Just use water, your hand, a clean washcloth, whatever. And she's like, no, gross. I want to feel fresh down there. I'm going to use a soap. And so she challenged me to make a soap that was not drying and make you itch and all that stuff. So we created, I don't have it with me, but we have this, it's upstairs in my bathroom when I go through them really fast. This non-soap soap, it's this like really beautiful French milled, it's made of coconut oil and jojoba oil. And it's really refreshing and clean ingredients, pH balance, and very moisturizing. So that's one of my go-tos. My other go-to is this one, the hydrating serum. You can put this on your vulva, similar to Foria's vulvar serum, which I also have used, which I think is great. But I like to put this on my crow's feet and my hands. So it has a lot of the stuff that really expensive serums have, right? But I use it as my inexpensive serum, but it works great for dryness. So that's another go-to for me. And then if you're really in perimenopause and menopause and having hot flashes and night sweats, we have these great things called Cold Her, where it's this phase change material where at room temperature or at room temperature it's solid. You put it like you're sweating or it's after a workout, you put it in your bra and it cools down and it becomes liquid. But the awesome thing is you don't have to put it in the freezer or the fridge. It'll automatically turn back to solid within 30 to 45 minutes and then you can use it again. So I just keep them in my purse. Like I get a little when I'm flying on a plane. So I can take them out of my purse, put them on, put them back in my purse, and then by the next layover or whatever, the next time I fly, they're ready to go. So those are my awesome basic products that I love. And then the Foria stuff I've really started to really, really enjoy. I like the body wash. I've used that a bunch. And then the Vulvar serum and the massage oils really great too. So Foria and Joylux have got it going on. We just have some really great products. And I'm so happy you could join me here today. I think it's really important, as I've said a million times, to talk about sexual wellness and sexual health and think about what works for your body, to not be, embarrassed or feel stigmatized that things are not going the way you want them to be or the way they used to be. There is a reason for it. There is help, tools, and support. So anyway, I wish you well. And again, I hope you feel empowered and more knowledgeable, and to remember that perimenopause and menopause it's not an ending. It can be in a really amazing chapter in your life, especially if you feel empowered and ready for it. All right, everybody, take care. Hope you have a good night. Take care.